Chairman, the Union Health Minister, said that organ donations in India have tripled in the past 10 years. He said that over 15,000 organs are now donated annually compared to 5,000 10 years ago in 2013. He also talked about the contribution of medical professionals in the endeavor of carrying out transplantations and organ donations and how they're extremely important. Particularly, he talked about deceased organ donation and its role as far as transplantations are concerned. Because remember, the numbers as far as organ donation is concerned in India have been bleak in the past couple of years. But the government has taken several measures in the past years or so to increase organ donation. In fact, the Minister of State for Health and Family Welfare has also pledged organ donation. He said that there's no greater service than organ donation. Let's listen in to what SP Singh Baghel had to say.
आज 13वां ऑर्गन डोनेशन डे पर हमारे स्वास्थ्य एवं परिवार कल्याण मंत्रालय ने मानिक शाह ऑडिटोरियम में हमारे कैबिनेट मंत्री डॉक्टर मनसुख जी के नेतृत्व में हम लोगों ने एक आयोजन किया था। उसमें जिन लोगों ने ऑर्गन डोनेट किए हैं उनको, जिनको ट्रांसप्लांट हुए उनको, जो सर्जरी की है उन लोगों को, जो NGOs पे काम कर रहे हैं सबको सम्मानित किया। वहाँ एक शपथ प्रोग्राम था कि हम अपना अंगदान करेंगे और लोगों को प्रेरित करेंगे। तो जब मैंने ये शपथ ली और दिलाई तो मुझे लगा कि चैरिटी बिगिंस फ्रॉम होम।
And joining me now, a very special panel, Dr. Rahul Chandola, founder and chairman, Institute of Heart, Lungs Diseases and Research Center. He's a cardiothoracic and heart lung transplant surgeon. Also with me, Dr. Rajiv Jayadevan, member of the Public Health Advisory Panel of Kerala. He is also a member of the state IMA. He's author and public health expert. Thanks so much, gentlemen, for joining us on this very important discussion. Going across to you first, Mr. Rajiv Jayadevan, how important is organ donations and how do you really view these numbers? Because for the longest time, we've seen that India, when it comes to organ donation, has been lacking behind. But these are encouraging numbers. In the past 10 years, organ donations have tripled in, since 2013.
It is definitely an achievement to have increased our organ donation numbers. But let me tell you something. The general population has very limited idea about the concept of organ donation. Now, many people in the world and in our country live in misery from end-stage organ failure. For example, kidney failure and liver failure. The only treatment that is available to them is a fresh, healthy organ. And unfortunately, with all the medical research, scientists have not been able to create a spare part. In other words, a lab-created organ is still not a reality. So the only option we have are organs that are available already to us, that is what's called deceased organ donation.
Right.
Death is inevitable. We all will die. But at least a few of us can donate our organs to these individuals who then get a normal span of life. It's a gift of life.
Absolutely, and something that the minister also said that it's a second shot at life that you can give to many people, and of course it aids transplantations, and that is something which is extremely important. Dr. Chandola, let me get you in here. One point that I wanted your opinion on is that the 65 years age restriction, that this limitation has also been removed. How do you view this?
That certainly is going to improve the number of donations. Especially some organs like, the kidney and the liver, the donors can be more than 65 years of age. The liver and kidneys generally, can be utilized. But if you talk about the organs like heart and lungs, the heart, generally we prefer to use donors less than 60 years of age. And the lungs also, less than 60, 65 years. 65 is the maximum, that you can take the lungs from any donor. Beyond that, the lungs are so frail. They're very fragile organ, and generally beyond 65, they are not, you cannot utilize those organs,
Yes.
So as far as heart and lungs is concerned, increasing the age limit, of donors probably is not going to help. But yes, for the kidneys and liver, it certainly is going to increase the pool of donors.
Absolutely. And Dr. Rajiv Jaydevan, there's also this point of how there's some level of superstition that is attached to deceased organ donations. There is some level of people are often apprehensive. They have their own anxieties around deceased organ donation. So how do we create awareness in a country like India where there is this level of superstition when it comes to deceased organ donation?
Good question. In fact, it's quite deep in terms of neurology. A superstition means belief, and a belief is rooted in our limbic system of the brain, and it's difficult to counter these with facts. We may think it's easy to talk facts and get rid of such beliefs. It is not so easy. So this is an uphill task for people in the healthcare fraternity and people in the media and communicators to let the public know that no human organ must ever be wasted if it can be avoided. So let's say if 100 people die, all 100 of them, even if they wish to, they cannot donate for multiple technical reasons. At least those that are technically feasible must be able to donate all their organs by default. And unfortunately, only a tiny fraction of what is donatable are being donated. And there is a lot of work to do. So sustained community education programs, talking in language people can understand,
Yes.
using simple terms, using simple metaphors, and people of authority have to come forward and talk to the general public. There is rampant misinformation about organ donation, which is turning people away from donating.
Absolutely, misinformation, and a new language needs to be found to convey the importance of deceased organ donation. But Dr. Chandola, you are somebody who works on a daily basis with transplantations. How important is organ donation for you? How does it aid transplantation? Because the kind of things you read are fascinating, that an organ donation can actually increase somebody's lifespan by many years. So talk to us about that, because that is something that will actually encourage people in moving towards organ donation.
Right. So as you can see, increasingly more number of people are living with end-stage organ diseases. Like, there are, such a high burden of patients living with end-stage heart disease
Yes.
or end-stage lung disease. All these patients who are transplant candidates, they run in lakhs. That's the number of organ transplants which are required. If you talk about single organs, say the lung transplant, so roughly around 1 lakh lung transplants are required in the country. That
Absolutely.
Many patients actually are living with the end stage lung disease that
Right.
require lung transplant. But how many of them are getting it? It's only 150 to 200 transplants every year are done. I'm
Right.
talking about the lung transplants.
And the point you made
and
also
that's
that
because-
the burden of chronic diseases is so much, and in that case particularly, organ donation is something that should be normalized, should be talked about more as we go ahead. Thanks so much, gentlemen, for joining us on NDTV.